In our morning rounds this morning, a big change in the guidelines for treating high blood pressure. A report out today by a panel of experts says fewer older Americans may need to take the medication to lower their numbers. Well, we want to know, what does that mean exactly? Dr. Holly Phillips is with us and joins us at the table.
Good
I am
morning,
curious
Gail.
about, good morning to see you, Dr. Phillips. The word older, what does that mean in this case, and what are the changes that you're talking
Sure.
about?
Well, for years, normal blood pressure has been defined as 120 over 80.
Yeah.
If you reached a point of 140 over 90, that was considered high blood pressure, and the point at which doctors would suggest you start taking medications, as well as lifestyle changes. The biggest change with these new guidelines is that if you're over the age of 60, the threshold has been pushed up to 150 over 90. That's when you would start medication.
What's driving this change?
You know, it really comes down to data. This was an independent panel that looked at more than 30 years of really strong research. They call it kind of the gold standard of high blood pressure research. And they found that if you had a blood pressure of 150 over 90 and you were over 60, by lowering it, you could cut down on heart attacks, stroke, kidney disease. But what was really surprising is that if you pushed it below 140 over 90, it didn't add any benefit. There really wasn't any change. So that's why they've decided to push the threshold up. We have to point out, though, not everybody agrees, and the American Heart Association has said they're not sure they're going to adopt these guidelines. They want to do their own research first.
So if you're on blood pressure medication now, what should you be thinking about, worried about?
Right. Well, the panel was very, very clear. If you're on blood pressure medicine right now,
Over 60, we should.
Exactly. If you're over 60 and you're on blood pressure medicine right now, there's no need to make any change. You might want to talk with your doctor about your blood pressure goals the next time you come in. You might be able to lower your dose, or if you're on several medications, maybe you only need, maybe you need fewer. I have to say, though, in practice, high blood pressure is one of the hardest things to treat because it doesn't cause any symptoms. In my practice, it's hard for me to tell patients, here, take these medications that might have some side effects when you feel perfectly fine. But the issue is blood pressure is an insidious illness. It kind of eats away at your vessels and your heart and your kidneys, and you're not aware of it until it's too late.
That's why they always strap that thing on your arm.
Yeah.
It's one of the #1 indicators of your health is your blood pressure, right?
Very much so.
Thank you, Dr. Holly Phillips.
Great to be here.